Okay, gentlemen, we are live, and I thank you for joining us today. Thank you, guys. I'm going to just take a second to hit the record button for our folks at Tutuka TV. So, good afternoon, everyone. I'm Mike Paulus. I'm the town manager, and I'd like to welcome you to our weekly briefing and thank our team today, Chief Seward and Jim Buck, EMD. Unfortunately, neither Chief Halloran or the Deputy Chief could join us today, nor could Mike Pascasella, East Shore Health District Director, but we hope to have them back for next week's briefing. As always, our goal is to bring you up to date on what we're doing to combat the COVID-19 virus and provide you with reliable information and resources as we deal with this pandemic together. We'd like the broadcast to be interactive as well and hope that you'll participate by sharing with your friends and family. If you feel free to post any comments, and we also have our dedicated email, which is public-comments@townofnorthbrantfordct.com. Again, public-comments at townofnorthbrantfordct.com. So before we begin, there's other sources out there as well. Our town webpage, www.townofnorthbrantfordct.com, and of course our police, fire, EMD Facebook pages, and other information be found on East Shore Health District's website, as well as the State of Connecticut Department of Health website and the governor's website. So a lot of information out there for you to take advantage of. And obviously, you know, these weekly briefings are you know, put that information out there, which is ever changing every day, every week. You know, the governor will be on again today and pushing out information from our understanding about the phases, and so it's a lot to keep track of, and we're doing our best to try and give direction and point you in the right direction to get that information. We have typically go into the update, which I will, but again, always want to thank our first responders and doctors and nurses, healthcare professionals, everyone out there on the front line in grocery stores as well, helping us get what we need, and you know, keeping us all going from day to day, which is great. And a lot of great stories coming out of here too, from every community, not just ours, but about how people are helping people, and that's great. A lot of great stories of people coming together, communities coming together. And we like to end the program and the briefing each week with just one or two comments like that, which we'll do at the end of this briefing. But I want to start with the report and get into that. Some good news with respect to the numbers. And again, this is a running total of numbers since the pandemic started. We now have recorded 83 confirmed cases with 6 fatalities, unfortunately. So the number, I think last week after we did the clarification, was 80 positive cases. We're holding at 83, which is good. So it indicates a flattening of the curve, if you will. It's not as growing at the way it was when we first started bringing you these briefings. So at this point, you know, we're doing relatively well in considering what's happening in other communities, and I do have some additional stats, or maybe that just kind of puts it into place, a little bit of a detail with some graphs that have been provided by East Shore Health District. And I'd like to just take a moment, see if I can make this work and share the screen and go through some of those numbers with respect to East Shore services, not just North Branford, but East Haven and Branford. And obviously those communities are larger than us and have also have nursing facilities, and that seems to be where a lot of the issues lie in a vulnerable population like that. So I'm going to try make an effort here to share the screen and show you some of the graphics and numbers that we have, and breaking down not only our community but how we compare to those around us. So bear with me. Let's see if we can do this. Okay, so on your screen, tell me, Jim and Chief, if you can see that.
Yes, I see that.
Yeah, so that a day-by-day graphic, I guess it looks like from May 15th, so the last 20 days or so, showing different colors if the colors are coming through on the graph. But the box at the bottom will show North Branford 83 cases, none in a facility case related. So Branford 325 with 90 cases coming out of the nursing facility, East Haven with 391. With 30 coming out of the nursing facility cases. So it just kind of gives you a perspective with two surrounding towns around us. And you can take a look here again, our difference, 6 fatalities in North Branford, none coming from the care facilities, all from the community. And obviously one too many. But we are doing our part, and you can see North Branford and East Haven obviously had some difficulties in those care facilities. But our daily case looks like 7. Let's see, May 15th. That's Branford, but down at ours, I think we're looking at 17 in the last 20 days. And again, you see some stretches there where we have 0 reported cases. So just wanted to kind of take a look at that, break that down, show how what we think is a flattening of the curve since at least, the mid part of May. So a little bit of extra info there on our breakdown, but still have to be vigilant and cautious as always as we get through this. So I'm going to try and take this down and get back to the script. Still got to do our part, and the virus is highly contagious. So in order to in order to slow the spread, we've got to continue to practice social distancing. Stay safe by staying home if you don't have to go out, but if you do, maintain the 6-foot minimum. And wear a facial mask when interacting with others. And as always, if you're not feeling well, don't go out. And if you're feeling that you need to, call your doctor and make sure you get the assistance you need. So that's our number. I hope that my 2 colleagues will agree that I think the community has done well, and yet we're not out of the woods. Although I like to think we are inching closer. In the second part of the briefing today, we'll be talking about our partial reopening. So we are getting there, but maybe I'll start off with Jim Buck, Emergency Management Director. And Jim, if you just want to let us know what you're hearing from the state, anything new you want to add as we continue to practice the right protocols.
Thank you, Mike. I think you've really summarized well for the town where we stand, the highlight on new cases. And I think it should be mentioned too that although the new cases are trending very, very much downward, that is in addition to the increased availability of testing. So this is something the governor mentioned on one of his prior press conferences, is that we're seeing fewer new cases with the combination of increased testing, so that percentage rate that's positive continues to decrease. And that's somewhat expected with the increase in testing, because you're getting more people that are asymptomatic, that don't have any presenting health concerns. But it's also important to mention that there are still positives amongst those that are showing no symptoms and they're asymptomatic, that don't know they have it. The fact that they're free of symptoms might be good news for them. However, it's not good news for those that may develop complications after coming in contact with that individual. So I think it's a good time to discuss the best and simplest method to protect is if everyone is when out in public, wearing the mask. Continue to do so. We're seeing restrictions relax even further. There are a lot of discussions underway as it relates to when the restaurants will open. There were, fully reopen, and there was a push to try to move that up. And I think the governor to stay on the track and the path that had been set for that. we're getting more and more businesses have participated in the program to get protective equipment. They are requesting that through the CBIA resource that is then picked up by us, the town, at our distribution point, and is available for pickup at Town Hall. Is that still correct, Mike? Are we still seeing a good number of businesses?
Yes, absolutely. There's been a steady flow, and we're making contacts, making phone calls, and people are coming by on a daily basis to pick those items up.
So business owners have uncertainty. They have questions about how to proceed properly. The guidance is out there. East Shore District Health has been a great partner in reassuring businesses, making sure they have the correct information so that they, aren't acting based on rumor. They are acting based upon the guidance and recommendations through the CDC, through the state Connecticut Department of Health. So I think I would just summarize by saying, let's stay safe. Let's be smart. It's getting warmer. People are going to be a little more resistive to wearing PPE. As a career firefighter myself, I'm sure Chief Seward can chime in as well. There are many times where that PPE is uncomfortable to wear due to temperature, but you wear it because you need to. You wear it because it's going to keep you safe. And especially in the case of something like the COVID-19, it's going to keep those around you safe. And let's continue to practice the safety at all times. Utilize social distancing. Restaurants will be opening, but at a reduced capacity. And I think that's an important thing, is that things aren't going to normal. Nobody should have in their mind that we're resuming normal operations. Just like the town hall plan that you're working on and will be, moving forward with resumption of services. These are not normal times. We're not entering normal. So we're entering a more relaxed stance on some things. So let's continue to be smart. I think that the people in town should be both proud of their actions in maintaining safety, and also hopeful that we're going to be of this soon. We're not clear of it yet. And then one last thing, I think it's important to highlight the facilities. And you mentioned how the facilities in North Branford show 0 cases. That no one person on the screen today here can take credit for that. That is through the direct efforts of those responsible at the facility, the emergency planners and the administrative officials at the facilities, to make decisions to keep the people that they're charged with safe. And I know people have done that in cases, and they still have had positives in other locations, but it has worked out very well for those administrative officials and the emergency planners in our facilities. And I think that should be commended. They've done a great job.
Great. Thank you, Jim. I appreciate it. And I want to now bring the Chief Seward into the conversation. And then, Jim, you mentioned a lot about the PPE, the personal protective equipment, and the ordering going on. And I know the Chief's involved in as well in terms of, sounds like the fulfillment side of the is working as far as I know. But why don't you tell us what you see there, Chief?
Sure. And Jim and Mike, you both bring up excellent points, great strategies that have been developed and put into place in town to keep our residents safe. And they're listening to us. And that's so important. The state has been able to provide EMS responders in each region with higher levels of personal protective equipment over the last month and a half or so. On Tuesdays, Region 2 makes a distribution point available in North Haven, and gloves, gowns, goggles, masks, thermometers, face shields have all been issued to fire and EMS response agencies statewide, to the point where it's the governor's direction to be able to provide us with 30 days of personal protective equipment, so that if we view an increase in COVID-19 patients in the future, we're adequately protected. And the state has been very successful, and we appreciate all their efforts. From the fire department standpoint, when at the highest point of patients coming out positive, we saw a lot of patients basically not accessing the 911 system, holding off on going to the hospital. In the last month, that has completely turned around. So we're back up responding to those calls and seeing those patients that we had not over the last 2 months. So we're returning to normal, but our normalcy has changed. From the fire department standpoint, we're back doing training, we're back conducting meetings, but in a new way. And just like as communities start to open and town facilities reopen, there are restrictions. So we have our own in-house restrictions to follow, just to make sure that we protect one another while we conduct our normal business. So with that said, I think we've touched on all the other points that are really important to bring out to our community. And we're working well with our medical director from the Yale Center of EMS, and the fire chiefs from the surrounding communities are, again, working cooperatively and collaboratively on many efforts and focusing on many new challenges. So with that, I'll turn it back to you, Mike.
Great, thank you, Chief. Yeah, I appreciate your insight there. I know you're working hard to get up there every week, North Haven, and again, it's all about keeping the pipeline open and fulfillments keep coming in, which is, it's a great help, and I appreciate that. And we talk a lot about trying to get one step closer to something that looks and feels like normal, right? So the phase-in approaches or phases as they come, we'll inch our way closer to figuring out, well, is this working or not? So, to that end, I want to segue into the second half of the program, talk about partial reopening. I mean, last week we talked about the tax payment extension program and mentioned that we have partial reopening going on. The tax program deadline, by the way, is still June 30th, so there's still time to apply. There is a few weeks left to that. So if you have any questions, certainly call Town Hall, and we can certainly make sure that we get you signed up for that. So, partial reopening, what's that going to look like? What's that going to mean? And so what we're focused on right now is Town Hall at the moment. And the partial reopening certainly is going to be about appointment only. So we're encouraging people to still continue to do the transactions or the business that they can do electronically, online, remotely, if you will. And encourage you to do that. And for those items that just can't be done electronically, then that's what we're opening up by appointment call, and we'll have staff meet you at the door and be allowed to come in to take care of the business that can't be done electronically. So we're going to have a very thorough safety plan in place, not only for the public, but for our employees as well. So we've got necessary PPE in place and signage and protocols. So it just took us some time to get through that, and we now have the necessary equipment and material to do that. So the Town Hall will do that. Unfortunately, the libraries won't be ready to open, but I will talk about a program that they have for no contact curbside pickup that they're going to start on Monday. So libraries, unfortunately, and our rec department and senior center, by the governor's order in terms of health phases, will not open anytime sooner than June 20th, although there is talk out at the state level that might actually be upped and might be pushed up sooner. Again, we just have to wait till that's publicly released, but we'll adapt and we'll go with that. We'll make our plans. So in the meantime, we have a partial reopening for Town Hall, and as I mentioned, neither Chief Halloran nor Deputy Chief Lovelace could be on the call or the briefing today. But they did mention that they at the police department will be partial reopening for fingerprinting, which I know is a big issue, and there unfortunately is a backlog. But any of those individuals or residents that are looking to get that done, that the police department will be reopening partially for I believe on Monday, the 8th as well, for fingerprinting. You'll have to contact the records officer, Officer Paroli, but be aware that there is a backlog, so it'll take some time. And even here at Town Hall, those appointments, again, we're closed to open. We do not have open hours. We're open by appointment, and we'll have to, by staffing and staffing levels, it may not be every day. It may have to be, depending on what department you're looking and what business transaction you need to do, from the clerk's office to the assessor's office to the building office. It just really depends on what our staff can handle with respect to the calls and appointments. So please be patient, but we'll try to get. We'll try to service every resident that we can, and the best way we can, and keeping both our employees and you, the public, safe. So we'll do that. And what I want to do is talk about the no contact curbside pickup for the public libraries, which is going into effect for Monday, June 8th. So how is it going to work? Well, let me just kind of read through the program guideline that was provided to me by the library director, Lauren Davis. How does it work? You're gonna request your materials, and I'll go into that. So request the materials. So you'll receive an email or phone call when your materials are ready for pickup. You'll be able to drive to the front entrance of the library for pickup. You'll have to call the library, let them know that you're there, and staff will come out and place materials in a bag on a table by the main entrance for pickup. So this is all no contact, right? So we're keeping distance, and they're setting up a situation and a system here that be able to keep everybody safe, but still be able to provide the materials. So how do you request the materials? You can use the online catalog to search for North Branford owned items. Look for items that are listed as on shelf at North Branford Atwater or North Branford Smith, and log into your account and place the items on hold by clicking the Place Hold button. You may also email your request to requests at North Branford Libraries, which is actually nbranfordlibraries.org. I'm going to say again, requests at nbranfordlibraries.org. And I believe this is all on their website as well. But include your name, library card number, requested titles. And again, call Library, Smith Library, or Atwater. They can help you through the process. And so the number for Atwater Library is 315-6020. And Smith Library is 484-0469. And staff member can certainly help you with the process. And going to be a learning curve, and but we're trying to make it as easy as possible, and trying to get the materials in your hands and allow for an interaction and use of the library without actually being in the library. So they'll get that ready for you, and of course they have a policy and details on how to return. So the returns will be put in an outside drop box. Again, no contact. It'll be a simple drop box type of thing, and they'll make sure that they have a health and safety plan for the return of those books that go into a 72-hour hold in quarantine before they can obviously go back out, and they have to make sure they want to keep everybody safe and doing that. So if you're interested, please contact staff members at either of those numbers, and go online or email the request, and they can help you with getting materials out, which I think is a great first step in trying to get back to normal, whatever that's going to look like in the future. But before we are fully open, and I'm not sure when those plans, other than later, sometime after June 20th for our libraries and our rec department senior center. So we are working on those plans, just like we have here for Town Hall, and hope that the governor will lift or loosen restrictions on the public facilities and public buildings to allow people to come in and do it safely. So that's what we have in terms of our rollout beginning Monday, June 8th, and of course looking for the guidance from the state and our health department going forward. So just stay tuned. We'll continue to do the briefings every Friday, and we'll be able to tell you what's coming next Friday. So with that, I just want to get a moment just to check to see if there are any public comments. Let me just check for that real quick. And I do not see any of those, but I know we also have our Deputy Fire Chief and Finance Director, Anthony Esposito, monitoring us, monitoring the Facebook posts for us as well. And I don't see any of those coming through at the moment. So while we're waiting for that or waiting for something from Anthony, I'll just speak to the Sunday memorial event that we had here at Town Hall. And thanks to Reverend Vance Taylor, North Branford Congregational Church, put together the event on Sunday. I thought it was well done. And also to the Reverend Lucy LaRocca, Zion Episcopal, and Reverend Robin Blunden of Northford Congregational Church for joining us. So it was a very nice ceremony, and I, also have flags out there for anyone that would like to call in and would like us to, put a flag out, and someone that has dealt with COVID-19, have been positive, or someone that you know of and a family member, or it could be a first responder or someone that has, been on the front lines and you want to honor them, that's fine too. I think it's just a great way for us to reflect, and again, to give pause and thanks for the ordeal that we're all going through, and it affects us all in different ways, but we're trying to stay positive, try to stay upbeat, and I think we're doing that. And there's a great amount of collaboration, a great amount of community spirit that's coming through, and donations, by the way. And I like to, I guess, end with that, since we do not have any posts and we do not have any comments at this point. I will say a thank you to the owners operators of Wasabi Restaurant, who again donated another 500 masks, the KN95 masks, so bringing their total to 1,500 for the town, which is just can't thank you enough. That's been great. And looks like we've got one post here. Want to know about sunflower seeds, not COVID related, but yes, we are working on our sunflower project despite the pandemic. We do have seeds on order. So I will make a note, and hopefully we can give you some details for next Friday. But I do know that those are on order, and we're working to get those here and get the envelopes. And so I'll have an announcement for next Friday. And that's it. I think that's the only post we have, no comments via email. But certainly hope folks will take advantage of the library no contact curbside service, and continue to tune in and follow us on these weekly briefings and share with friends and family. Gentlemen, anything you want to add before we go?
I think I'm all set, Mike.
Okay, Jim?
Yeah, nothing from my perspective. Thank you, Mike.
Okay, I want to thank you, gentlemen, for joining me as always, and everyone be safe and stay healthy, and we'll be back next week. Thank you.
Thank you.